Tetanus. It is another important topic in epidemiology of communicable diseases. Tetanus agent. First, we'll talk about epidemiology, agent, host, and environment. Agent, it is caused by Clostridium tetani, which is a gram-positive aerobic bacteria having spores. Clostridium tetani. Reservoir soil or dust through RTA. It infects spore-forming aerobic bacteria. Spores are present in soil, dust, animal dung for years. This is an exotoxin. Toxins have two types: tetanus plasmin and tetanolysin. Tetanus plasmin and tetanolysin. Tetanus plasmin. Lethal dose for 70 kg man is 0.1 milligram. Source of no man-to-man transmission is known from soil. RTA from soil, the spores wound will be contaminated to soil. From soil, it enters into the human body. There's no man-to-man transmission. Types: traumatic tetanus and neonatal tetanus. Traumatic through RTA for adult, neonatal it's also known as 8th day disease. As a parent of the child takes the child to the hospital, the 8th day, as its incubation period is 7 days, and tetanus that is infected during the delivery after 7 days of incubation period will come on the 8th day for treatment. So this is also known as 8th day disease. Mode of transmission through wounds, cuts, burns, contaminated instruments like knife, nail, needle, all those. Host factor, unvaccinated individuals. For neonatal tetanus, mother may not have taken TD vaccine during her pregnancy or gestation. Host factor, unvaccinated. Elderly, agriculture people, all those are risk groups. Incubation period, it's 21 days, 3 to 21 days. You can remember 21 days, 3 weeks. Types: generalized tetanus, neonatal tetanus. This generalized tetanus is traumatic tetanus. Clinical feature: lockjaw, rhizus, sardonicus. These are the clinical features: muscle spasm and stiffness. All you know. Ophistotonus, that is contraction of muscles like this body. This is head. This is ophistotonus, contractures, muscle contractions. Next, coming for the treatment, management, prevention, and all those. We have to neutralize the toxins. So tetanus immunoglobulin 500 to 3000 international unit. There are two types of immunoglobulin, human and equine immunoglobulin, but human immunoglobulins are preferred. We have to control infection by giving metronidazole, which is a drug of choice. Penicillin, metronidazole. Penicillin can also be given as alternative. Proper wound cleaning and debridement if necessary. We have to control spasm by giving diazepam, baclofen, or muscle relaxants. If not, we have to give general anesthesia. We have to keep the patient in a dark room or quiet room. Supportive care, airway, IV fluids, nutrition, and we have to treat autonomic instability. Inactive immunization, we have to give complete TD vaccination 3 doses. Disease does not give immunity, even after recovery, disease does not give immunity. Even after recovery, we have to give active immunization. Neonatal tetanus. Tetanus occurring in a newborn due to contamination of umbilical cord within first 7 to 14 days is known as neonatal tetanus. Causes or risk factors include delivery in unhygiene conditions, untrained birth attenders, using unsterile blades to cut cord, apply cow dung, ash, or ghee onto the stump, mother not immunized with the TD, poor marital health status. These are the risk factors. Presentation of neonatal tetanus appears on day 3 to day 10. Inability to suck or feed, excessive crying of the baby. Next, stiffness of the muscles, spasm, ophistotonus. Management of neonatal tetanus. Tetanus immunoglobulin 500 international unit. Antibiotics like penicillin or metronidazole. Spasm control, diazepam. Maintain hydration and feeding through nasogastric tube. Manage complaints of apnea and dehydration. We can prevent neonatal tetanus through maternal immunization with 2 doses of TD. If this dose has not taken in less than 3 years, only booster dose is given, which protects both mother and the child. Clean delivery practices also prevent transmission of tetanus. Skilled birth attenders, sterile blade, clean cord tying kit, no application of cord, dry cord care. Clean cord care, keep stump dry, avoid dust, dung, or ghee. Strengthening immunization program, universal immunization of child DPT vaccine. This is about the tetanus. Once I'll say what is there in the notes. Tetanus is caused by gram-positive anaerobic spore-forming bacteria, Clostridium tetani. Reservoir soil or dust. It is two types of exotoxin produced by Clostridium tetani, tetanus plasmin and tetanolysin. Lysin breaks the RBCs and causes hemolysis. Tetanus plasmin causes muscle contraction. 0.1 milligrams for 70 kg. This is a toxic dose, no man-to-man transmission. 2 types, traumatic and neonatal tetanus. Prevention through TT vaccines. Now TT vaccines in the pregnancy, 2 doses. And DPT. TD is a tetanus toxide, where in toxide there will be antigenicity, that is immunogenicity, no toxicity. Adult dose for diphtheria toxide. Immunoglobulins, human tetanus. Hyperimmunoglobulin. Assess. A clean minor wound less than 6 hours means have completed primary TD vaccination means yes or no. If no, vaccination should be given. If already completed primary TD dose of vaccine means was recent dose within past 10 years. We have to see. If it's past 10 years, not necessary vaccination. If it is taken, not taken, or very long back, vaccination is needed. Next, other wounds more than 6 hours. Other wounds contaminated with a disc, puncture wounds, avulsion, burns, or frostbite have completed the primary TT vaccine. If no, vaccination with immunoglobulin. If they have completed primary tetanus, diphtheria services was most recent was done within 5 years. If it's done within 5 years, vaccine is not necessary. If it's not done, vaccine plus immunoglobulins are administered. This is all about the tetanus. If you find this video helpful, please do like, share, subscribe to my channel. Thank you.